We'll discuss about infant reflexes and their clinical importance. Um, like there are many kind of reflexes, but most commonly which you think about are Palmar grasp reflex, Moro's reflex, and Babinski's reflex. There are others also we'll just keep an eye on, but let's talk about these things. So, infant reflexes are very primitive and involuntary movements, and they provide insight into the neurological development of an infant. These reflexes usually emerge sometimes during pregnancy and are present in birth and disappear as the nervous system is maturing. So, we are discussing about three reflexes. So, let's say Palmar reflex. Palmar reflex is when an object is placed in the infant's palm, they automatically close their fingers around it. This disappears around 5 to 6 months. And presence of reflex at birth indicates that there is a function and proper function of central nervous system and spinal cord. And a gradual disappearance signal that there is maturation, which is normal maturation of motor control. So, for example, let's say that the child is brought for a well baby checkup and the pediatrician places the finger in the infant's palm, the infant palm closes tightly around the finger, demonstrating a healthy palmar reflex. If that is absent, then you want to think about cerebral palsy. So this disappears in 5 to 6. If it is not present in this time frame, then you want to think about cerebral palsy. Okay. Now let's go to Moro's reflex. Moro's reflex is also called startle reflex. In response to sudden movement or loud noise, the infant arms are extended outward and then return back to their body, often accompanied by crying. This disappears around 5 to 6 months. This reflex shows infant ability to respond to sensory input. Prolonged presence beyond 6 months means like there are neurological problems. Now let's go to Babinski's. Babinski's reflex means stroking the sole of the foot causes the big toe of the foot to move upward. And it's normal until 2 years of age. If it is present beyond 2 years, then it means that you have an upper motor neuron lesion. Upper motor neuron lesion. Okay. Then what is the clinical importance of this? Clinical importance is that these reflexes emerge at specific times and fade as voluntary control develops. Reflexes present beyond this time frame means like there are developmental delays or brain injury or spinal cord issues. So you want to think about the timeline. So at birth, all reflexes are present. 2 to 3 months, you're doing early check and reflex monitoring. So usually 6 months, all reflexes fade away, and 9 to 12 months, there is again, you do a review. At 2 years, Babinski's reflex is disappearing. So I hope that this helps you kind of giving you an idea of reflexes. Thank you very much.